Well, good afternoon, everyone. My name is John Marshall. I'm president here at CMU. We are so glad to have you on yet another Facebook Live, something of a tradition over the last year. That's one of the positive things to come out of the pandemic. I'm joined today by the special guest, the chair of our board of trustees, Alison Griffin. Alison, welcome. Thank you for joining us today.
Thank you so much for having me, President Marshall. It's a pleasure to be here, and congratulations.
Thank you.
The board of trustees is so excited over the last month having the opportunity to work with you in this transition to the presidency.
Yeah, it's quite an honor. It's been a humbling few months and busy, as you know. We've been spending a lot of time together, and you know, I was reflecting earlier about our last few weeks, and it's really been time to engage on a couple of key priorities right out of the gate. So spending time with faculty, spending time with students. Really appreciate Dr. David Collins, the chair of the Faculty Senate, Dr. Tim Casey as our faculty trustee, and really look forward to his leadership with the board in the coming months. Had a chance to chat with our student trustee, Aaron Reed, and for those of you who haven't met Aaron, just a substantial and really energetic young man who's going to be a fantastic student leader for us in the coming year. We've also had an opportunity to really hit the ground running with all of our key community leaders, everybody from the city of Grand Junction, Mesa County, School District 51, GJEP and the Chamber of Commerce, and the list goes on and on. We're just so grateful to be in a community that not only welcomes us, but it just is locked arm in arm with CMU's goals and priorities.
Absolutely. It's really exciting.
It really has been. Trustee Griffin.
Yes.
In terms of our work ahead here, we're excited to welcome students back on campus and kind of get going. I wonder if there's anything you wanted to share at the outset here before we jump into some of our conversation.
Absolutely. Well, I think, first off, President Marshall, I do want to welcome you again.
Thank you.
In your new capacity as president of the university, and also just recognize the incredible leadership from you, from other members of the executive team over the course of the last year with respect to the institution's response to the pandemic. Certainly the uncertainty that created for some of our students, our faculty, our staff, the community.
Sure.
But thinking through how the campus responded over the last year, I am so energized to welcome students back to campus in just a few weeks.
Isn't that the truth?
Just revitalized energy and enthusiasm for learning in person and back together again on campus.
Well, so today's episode is fun because in addition to you and I being on set, off camera here, we have Dr. Amy Bronson and Dr. Jeff Kuhr, head of Mesa County Public Health. So our show today is actually going to be a two-part show. So Chair Griffin and I are going to get a chat for a few minutes, and then we're actually going to trade chairs and let Dr. Bronson and Dr. Kuhr come join and talk more about COVID. So we'll save the COVID conversation for Amy and Jeff, and we'll, as always, take questions from you all at home. But before we do that, I think maybe worth reflecting on, to your point, how exciting to be back on campus and heading into what's going to feel like a lot more normal than last year was anyway. So we've been busy, really busy, getting ready for you all to come back to campus. For those of you who are new to CMU, we have been launching a variety of new special financial aid programs. The Colorado Opportunity Scholarship Initiative, or COSI. We've got a whole number of new scholarships available. And in particular, if you're in Mesa, Delta, or Montrose County, we've got additional resources available for you. Reach out to financial aid. We've also launched the Maverick Momentum Grant. This is a $2,000 block grant for students this year, new students and returning students, that's available to you to help offset some of the challenges of the pandemic. We hope that that's something that will continue to be an assist to keep you charging ahead toward your goals. Also, as Dr. Amy Bronson's going to come back on and chat in just a few minutes here about COVID, but it's also worth reflecting as we head into the new year, we've also got our partners at Mesa County Public Health, our medical and public health advisors, as well as Dr. Pardis Sabeti and all of our friends back at the Broad Institute of Harvard and MIT. And what a blessing it's been to have just world-class scientists and talent advising us as we've been working to navigate this pandemic based on science and based on evidence. But we'll let Dr. Bronson and Dr. Kuhr talk more about that. So, Chair Griffin, we're performing a new student orientation program this year, and admissions and Iris and the whole team at Residence Life has been working really, really hard. A special shout out to one of our professionals, Melissa Tolson. Melissa is an unbelievable talent, has been putting in a lot of energy and time. So for you students, when you get here, come say hi to Melissa and tell her thank you for all the work to prepare when we get here. And then I guess we wouldn't be complete if we didn't pause and reflect on, we have a lot of other fun things coming this fall, like Homecoming and Parents Weekend, which will be October 22nd, and there will be a variety of those kind of things to look forward to. Start to feel a little bit more like a real college campus in a normal year, right?
That's right. Well, bringing students, faculty, staff, members of our community together, it's always an exciting place to be for the fall. So.
Well, we're grateful for that.
Great.
So for those of you at home that are thinking about this, you probably are familiar with President Tim Foster. And President Foster, now President Emeritus Foster, really led this institution in a remarkable way, and such a humbling experience to follow such a visionary and transformational leader. But transitions happen from time to time, right?
Yes.
So tell us a little bit about what you see in terms of this ongoing transition through the course of the year.
Absolutely. Well, you're absolutely right. Institutions, whether higher ed institutions or other organizations, go through transitions all the time. And the one thing that I have found to be the steadying factor are the traditions and the history that we get to reflect on during those moments of transition. And we will actually have the opportunity to reflect on some of the history and tradition of Colorado Mesa University over the fall. We will be involved in an investiture ceremony and celebration. And that's probably a new word for a lot of us in the audience, right? Myself included, right? Just spending a little bit of time really understanding history, traditions, colors, academic regalia, all the things that make a university a really special place. And we're going to use that time over the fall. We've appointed a planning committee to really plan some events that bring the community together in celebration of both CMU and, candidly, President Marshall, your new role as president.
Well, it's quite an honor, and I love the idea of this investiture becoming something where we really get to reflect on our university and the traditions that make it special and worthwhile, and such an honor to get to be part of a team that's leading this great place. So really excited for that opportunity.
I am very excited. So I'll be back a number of times over the fall, but most definitely for all of those activities that are happening around October 18th, the week of October 18th to 24th.
Leading up to Homecoming and Parents Weekend.
Leading up to Homecoming and Parents Weekend.
That's great. So those of you that maybe had thought about coming back for Homecoming or for Parents Weekend, do that. We think that's going to be a really fun time and a great celebration for us as a campus.
I think so.
You know, it reminds me of one other thing. Something that happened over the summer that not everybody maybe is aware of is that as you ascended into this role of chair of our Board of Trustees, we welcomed 3 other officers on the Board of Trustees, right? So maybe you might tell us about that.
Sure, I'm glad to, because I believe we are the only all-female executive committee of a higher ed institution in Colorado. So Amy Lentz, who is a local Grand Junction community member, is a trustee and will be serving as our vice chair. Kasha Ivanechko McLeod, who's actually an alum of CMU, of Mesa State, will be serving as our secretary. And then Lori Buck, who is also a relatively local trustee, having served most recently as the mayor of Fruita, is our treasurer. And so
such a great group. 4
of us are so excited to be working with you.
Well, it is special, and I think worth reflecting on what a great transition for our campus that we get to have such 4 really innovative forward-leaning leaders like yourselves in that office for Kuhr. So that's going to be a lot of fun. Make sure they'll keep me on my toes, I assure you. So
we will.
Questions, per usual, we want to make sure that there's any questions that you have. We're happy to take those as we work through our show today. We know there's a lot going on, whether it's more broadly about the pandemic or specific to the start of school. Happy to chat about any and all of those. That's what this is for, is to really hear from you. So, Chair Griffin, I might pause for a moment. I know that we're welcoming lots of students back, and there's a variety of exciting things happening around the country. But one of the things that we're thinking about as we head into this is a variety of new academic programs that are finally getting a little bit of traction.
Great.
And thinking about those programs as, for those of you that are coming to CMU, new to CMU, that you might not be aware of. One of those is a burgeoning electrical computer engineering program. This is an outgrowth where we started with the University of Colorado with mechanical.
Yes.
We expanded that to civil engineering, and now ECE is really getting off the ground. And as we think about all the, what would it be, electric cars and all the software engineering that needs to be out there, there's a program to train the thinkers and programmers of the future. So that's one of them.
And we're doing that right here.
Right here, right across the quad there, with some really outstanding faculty between both CMU and the University of Colorado. A great partnership there.
Absolutely.
Okay, so looks like, Rana, you're wondering about the MAV Momentum Grant. Great question. So here's the good news. The Maverick Momentum Grant is going to be applied to your account when things pay over in August, and you won't have to apply for that. Once you are enrolled and you've got a full course schedule, that's going to pay over automatically, as long as you're a Colorado kid. If you have any questions about that, or if something doesn't look right, reach out to us. Our IRIS team is ready and willing all the time. They're just some amazing professionals on that team to assist you with your student account, making sure that all your financial aid is in order, and ensuring that your class schedule looks the way that it should. So reach out to one of those IRIS advisors to ensure, but to answer the question succinctly, if you're a Colorado kid, that Maverick Momentum Grant of $2,000 will pay over automatically.
It's great news for students.
Yeah, and it's specifically addressed at middle-income families, because we know this pandemic has hit, well, all of us in different ways, but we really want to address that middle-income family that's working to make sure that they're staying in school. So thanks for the question, Rana, and we'll reach out to our friends in IRIS if you have questions about that.
Great.
All right, so this is going to be kind of a dynamic show today, so we're going to take one quick second. We're going to welcome our colleagues, Dr. Kuhr and Dr. Bronson, to jump on, and they're going to spend some time chatting with you about COVID here. So with that, Alison, thank you so much for spending time with us. Such an honor to get to work with you in the coming years, and glad to have you on our Facebook Live tradition here.
I was thrilled to be here.
Yeah.
Thank you, President Marshall.
Absolutely. All right, we're going to take a quick break and trade seats, so don't go anywhere.
Welcome back, Mavs. Thank you again for tuning in, and we're excited to dive into COVID. I am joined by a special guest this afternoon, Dr. Jeff Kuhr. Most of you that live here in Mesa County know who Jeff is, and really has been so tremendous for this community in response to COVID. So thank you, not only for what you have done for the community, but certainly what you have done for CMU over the last year. This is not the first time we've been sitting in these chairs together.
Correct, and it's been a great partnership. We've done a lot. So.
We have done a lot. And I've really been reflecting, Jeff, on the fact that we have made a lot of, maybe a few more knowns heading into this year, but there's still a lot of uncertainty and unknowns. But I think I'd love to sit in a little bit of what do we know? What have we learned about COVID over the last 18 months? And how is that going to help prepare us as we head into the fall? So give us a little bit of your sort of take on what do we know a little bit more about COVID at this point?
Well, we know that still, and we hear this a lot, that it is about 80% of the people have mild or no symptoms. So that becomes an issue. And when I look at hospitalizations by age, it still is the elderly population that are more at risk. We learned a lot more when the Delta variant came because, we had heard with all the variants, starting with the UK, we had the UK, we had the California, we had the Delta. We had heard it was more contagious. We in fact saw that toward the end of the last school year for our K to 12. At the end we had 6 outbreaks in schools and they were fully masked. So we had not seen a school outbreak before. We had controls in place that we could stop the spread very easily. So yeah, we have learned that. And finally, I would say that we've learned, and I know there's a lot of research out there, but we have enough data in Mesa County to be able to see our own trends. And if I look at all of my cases since April 1st when vaccine was available to everyone, 88% of those individuals have not been vaccinated. So we do see the protection from the vaccine as well locally. Yeah, I know there's a lot of back and forth with certain research articles, but as I said, we really try to follow our own data and make our own conclusions locally.
Yep, and I think that's such an important piece to come back around to. We talk about what helps with some protective immunity, right? We know vaccines do help. And that is an important piece and strategy for helping to combat what COVID is. I think the other piece that I've heard you talk about some data around those that have previously had COVID also have a little bit of protective immunity. And maybe we could dive just into what we know from Mesa County data on immunity sort of in general.
Yeah, so, we've taking the definition of herd immunity at what it truly says, it's protection from vaccination or from antibodies from previously having had the disease. And so we've watched that very closely. We look at reinfections. Reinfections are the key. That's going to be the wall that we hit if we have a mass surge of reinfections that we know that the protectiveness has expired. So we're watching that closely because having just 45% of our residents vaccinated right now, we've got to look at other ways for us to get through this. And we have over 70,000 people. If I multiply the known positives by 4, which takes into account the no symptoms, 70,000 plus individuals have had COVID and 56,000 have been fully vaccinated. That gets us to about 80% herd immunity. But what we're watching very closely is, does that expire? I know that research has said it expires in approximately 8 months. But as I mentioned, the research is one thing, but we want to find out for ourselves what we have. And so far, that protection is there. And, the other thing I look at is reinfections. How many people have been reinfected? And we're only at about 75 people since the beginning. Wow. So, I'm holding up hope for herd immunity, which we're all accustomed to hearing about. And, as far as how long are we protected, yet to be seen.
Absolutely. Well, we appreciate that work that you've been doing. And, we are lucky enough to have really good data from here on our campus as well, as we've looked at herd immunity and looked at what that looks like for our campus, and really appreciate your team helping us dive into that data and help us figure out some of our safety protocols because of what we know around some of that data.
Yeah, and especially at CMU, as part of our partnership, which has been great, is we know, and you've done the calculations, we know that you all are exceeding 80% with those previous infections, and because you did such a great job in the spring, and really about monitoring. So, it's just what you've done here is really a tighter version of what we're trying to do. But I trust the data that comes out of CMU much more, and so that's a good example for us to follow.
Absolutely. Well, and I think when we talk data, I think one of the data points that I continue to come back around to is what we have learned and what we learned last year, and I think what we've seen in our community is there's no one silver bullet. We continue to come back around to it's the onion effect, right? And I think Mavs, as we think about coming back together this fall, that's the safety kind of protocols that we're really thinking through. We know, right, the vaccines are effective. Vaccines are an important part. We also respect that there are some that cannot get vaccinated, and we need to learn how we can also protect some of those in our herd that cannot make that choice.
Yep.
We know that masks can be helpful, and there are certain situations, and we've really adopted here at CMU the mindful masking, that there are times when wearing a mask is going to be important. We also know that there are specific strategies around being able to keep some distance and knowing that when we're indoors in large groups, what can help to keep us safe. And so as we continue to look through and think about deploying our protocols over the fall, I really want all the Mavericks out there to understand that we don't think it is one thing. We think it's a multitude of lots of factors that are going to help.
Absolutely. I think throughout we've made the mistake, all of us have, of sort of resting on one approach, and it really has been everything. In fact, let's go back to even the 5-star program. We've always said that one size fits all, closing everybody down is not the solution, because it's physical health, it's mental health, and it's the economy. And we've seen a lot of indirect impact of closing down when it comes to mental health issues. And so to your point, yeah, we've got to look at a lot of different variables when we're trying to solve this.
Absolutely. One of the things that we continue to talk about, and I think there's continued conversations now that are happening around vaccinated and unvaccinated and masking and not masking. And I think one of the knowns that we've kind of come back around to is masks can be helpful. And as we're really thinking about when masks can be utilized and really to be most helpful, help us understand what we know about masks. There's lots of different types of masks. There's lots of different deployment of it.
Yeah.
What's in that mask kind of conversation for us?
Well, from the beginning, and I think there was an error made early on when the CDC said that cloth masks don't work. And then all of a sudden we had a reversal of that philosophy. And so it was hard to convince people. But any type of mask is effective. I've told people to try this, because you always have the person that'll say, the virus is this size and it can penetrate. Well, it can, but the virus always has to attach itself to a vehicle. And, from an upper respiratory condition, that's going to be saliva and mucus. And, but, so I challenge people to try to blow out a candle with their mask on. And if you can blow it out, then you do have the wrong mask. But for the most part, you won't be able to. So that does tell you that there's not a direct airflow in or out from that. And the other thing, Amy, is during flu season last year, we had 2 positive tests for influenza. Influenza was non-existent last year. And, we followed the same guidance, or we put out the same guidance as we do every year. And that's always been keep your distance, wash your hands, clean your surfaces. This year, masks were part of that as well. And we know that we were all doing a really good job of following those protocols. But holy cow, I mean, that was incredible to not, because we were going into flu season thinking comorbidity, they're so alike. This is going to be very tough for us. And it was not an issue.
Yeah, it's amazing. I think about that work that was done over the last year, and really your team's willingness to be in on every conversation, every protocol that went through, and that has continued throughout the summer. And as we have sort of gone into a new era of an infectious and advisory disease committee here at CMU, I think one of the things that we've really been thinking through is around kind of our fall protocols around engage, educate, and empower. And I really feel like those three, when we put those together, because it is around education, we have learned a lot.
Yep.
And there are a lot of things that we can take from lessons learned last year to now say, okay, now we can apply that in a real meaningful way. And then we really need to engage around it, right? Because we need to remember, Mavs, it's going to take all of us to continue to look at our response to COVID. It hasn't gone away, and that we do know. And so we're going to continue to put strategies and safety protocols in place. And I think one example that I continue to think through in that is, how do you as a person start to ensure that you are making personal choices and sort of a safety strategy around how am I going to think through how to not only keep myself safe, but the greater Maverick family safe.
That's right.
And really thinking through what does that look like as we come back to campus.
Yep. Yeah, we, and that was sort of our approach early on in Mesa County as well. It's regardless of what you hear going on nationally, internationally, it is about pride in your community, pride in the CMU community. And so it isn't about just you, it's about how do we protect everyone around us and take pride in that and be the best that we possibly can.
Absolutely. I think one of the innovative solutions, sometimes I bring props, one of the innovative solutions that really came out of last year is realizing, when we have a lot of people coming together in the cafeteria and places where we eat together, one of the strategies is a lot of to-go items, but we didn't like our to-go containers, so we actually have gone, so I shout out to Whitney Sutton and her team and Sodexo that have really come together with some strategies to help students have avenues and choice around the ability to come in, still get food, but go outside and eat with your friends, or go back to your dorm room, or find strategies and ways to be able to decrease some of that communal piece that we can still have on campus, but you can do it in a safe strategy, in a safe way. So more to come on these, but these boxes are very cool.
It's a good idea.
Yeah. We have a question that has come in, and one of the questions has really been who was on our team and who was a part of those partnerships last year. And I think about our calls that we were on weekly with not only our partners from St. Mary's Hospital, Community Hospital, but we also had some external partnerships with MIT Broad Institute. So we really are so thankful for Dr. Pardis Sabeti and her entire infectious disease team who really came around us and could help us have perspective not only from a local level, but a national level. And I think it is those teams and those partnerships and the people that you were able to pull together to really be a part of a response that actually made all of this possible.
Yep, and that's community at work right there.
Absolutely, absolutely. I think the other question that, I think we get a lot of questions around, mandates and vaccines and, the choice for CMU not to do a mandate, but instead to engage people in a conversation around the why. A really big piece for us in coming back to campus last year was our why, that we are in service as an educational institution to really help people do critical analysis and critical thinking around what we do here on campus. And so we've really elevated that to saying, how do we now do that in our community? And how do we elevate the conversation of it's just not about me, it's about a greater Maverick family.
Yep.
And one of the things that came out of that was the Mavelies, and kind of being our people and being our family. And I think when we looked at our response, that was something that was very effective in helping us almost do kind of that cohorting model.
Yep.
So as you come back to campus, you're going to be finding those families and finding those sort of Maverick units that you're going to want to be a part of.
And it's a great approach, and it was so successful even with our local school district. With the elementary school kids, was keeping them in cohorts. They didn't have to wear masks in classroom; they wore masks while passing. So, the cohorting is one of those things that also gives us the opportunity to implement a various array of solutions.
Absolutely. Well, it has been so helpful to hear what's obviously happening in Mesa County. A big piece of our response here on campus obviously is very dependent on the integrated nature of our community. And so as we continue to look towards the fall, obviously, as we have said from the beginning, our plan is to be very nimble. We're learning every day. There is new studies, new sort of work coming out. We were just exchanging some stories about some of the newest studies that we have just been able to be privy to some new knowledge, and that is changing very rapidly.
It is, and you and I were talking about this a little bit ago. Mesa County got hit with the Delta variant very early. In fact, I was wondering, where is everybody, because we've got a pretty significant presence of the Delta variant. So now that it really is the talk of the nation, going back to that herd immunity conversation, I expect that we're going to be through this fairly soon, and so that might be reassuring for students and parents as well. That we've been dealing with this variant for about 2.5 to 3 months, and so we expect to be through it fairly soon. In fact, we're starting to see a decrease in cases and a decrease in hospitalizations.
Yeah, we love that. We love that good news. And although Delta is now on sort of the national stage, it has been here in Mesa County, and we've learned a lot along the way. But it is good to hear that we're trending down. We love that.
Yes.
I wanted to clarify, Anna asked a really great question. I wanted to clarify, we are not mandating masks. Here at CMU, we are engaging folks in mindful masking, and we're going to talk a lot more about nuts and bolts of what that looks like. The Infectious Disease and Advisory Committee is working through that right now, and as we continue to put protocols out here for everyone to understand what that means and what that looks like, we're going to help engage you in education around why masks work, when masks are important, and when we would say, hey, this is a time when we would really encourage you all to think about masks, not only for yourself, but for your Maverick family. So more to come on sort of the details of some of those protocols, but did just want to circle back to you, Anna, so thanks for the question. All right. Well, I am very excited for getting to welcome students back onto campus, but so thankful for our partnership, and I know we will have a road that we will continue to travel together. So just wanted to say thank you again to you and your team.
You're welcome. It's been a great experience for us to partner. And yes, this year will look completely different than last year, even though we're dealing with the same thing, because as you said, we've learned a lot. So I'm looking forward to going into the next season.
We have learned a lot. And I think one of the important pieces I continue to look at is a lot of our safety strategies aren't going away. We're going to still continue to have testing here on campus. We're going to have wastewater testing happening. There's still going to be an understanding of what's happening on our campus related to COVID. So the infrastructure hasn't gone away. The infrastructure is still going to be there, but I think it is going to allow us to be more nimble in how we respond, because that data will be even closer to our fingertips and helping us understand how to keep our campus safe. So.
Yep.
Thank you for your time.
You bet.
Mavericks, if you have more questions, please feel free to reach out to us at safety@coloradomesa.edu. But until next time, we will see you back here in a couple of weeks, same time of the day, and we look forward to engaging with you and continuing to answer those questions. Until then, stay safe, and we look forward to next time.